Welcome to the PT Coffee Cast, a podcast helping coffee-infused clinicians elevate their practice by realizing the tools they already possess. What's going on, guys? Welcome back to the PT Coffee Cast, brought to you by The Movement. My name is Dalton, and alongside me today is my trimmed but beautifully bearded friend, William. William, how are we doing today?
Doing good. That just made me think it'd be so cool to see like a timeline progression of the beard across the years.
Oh, yeah, that would be cool. It hasn't been to its true length
No.
in a very, 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 very long time. I think like a lot of people probably don't even really know.
It's been hibernating, just waiting for the time
Yeah.
to unleash its full power.
Yeah. Do you think it'll ever get there again?
I feel it will happen
Yeah.
Yeah.
When the time is right.
when the time's right. Exactly.
Fair enough. Well, we're back with another episode, guys, and we're super stoked to be here. If you're joining us for the first time and you don't know anything about where you can find our content, you can head over to Instagram. You can follow us there at PT Coffee Cast. You can subscribe to this podcast on your podcast platform so you don't miss out on any episodes. You can head over to the YouTube channel and you can check out the full video episodes of this podcast. You can subscribe there. We're trying to get that YouTube channel up to 500 subscribers this year. So we'd love to have you there. And then lastly, if you guys are looking for anything mentorship, themovementmentorship.com, you can check that out, learn all about the mentorship that we are putting on. You can reach out to talk a little bit more about that. But we're going to dive into today's topic. And it's a thought, a comment, a feeling I think that we get from a lot of students and new grads that are just like out in clinical practice, that, you know, we wanted to kind of address some of the ways that we look at it. And it's around the idea of the uncertainty of rehab and knowing maybe exactly what's going on or how you're going to get to this outcome, and then communicating with certainty to the client that you can help them get there. So trying to navigate that uncertainty of the rehab world is something that I think continues to be a challenge for us at times, and definitely when we were first starting was very challenging, and I think a big driver of like some of those imposter type feelings that you get as a clinician, because you're kind of like, how do I really help people and why are they coming to me when I don't know if I can communicate these things with any certainty to them. And so we're going to dive into that today.
Yeah, because I think what happens with a lot of people is they go into school thinking they're sort of going to get the blueprint.
Yeah, like you're going to get this blueprint to all the answers, and then whenever that comes up in practice, you're just going to pull out that blueprint and you're going to smack it down and be like, all right, here we go.
Here's how we solve this problem 100% of the time. Exactly.
That's so true. Like reflecting back on my journey into physio school, I think like you have that mindset going in. And even as you're going through it, because the way that we were set up with school is like we didn't really get up to do any placements until later in like our physio school journey. And so you're like getting all this like didactic information of like how you're going to go out and do it, and you're like, oh yeah, this is easy, like we'll just take this and apply it to, you know, the clients that we see. And then that first client that you see on placement, and you're just like, oh.
And a lot of it is like put in such a way where it's, hey, when you have this level of pain, you do this grade of mobilization, and that decreases the pain, and it gives you this false sense of control over how someone's feeling. And then you start, I think, toward the end of school, or just throughout it in general, you start realizing how inherently uncertain working with people in pain is.
Just people in general.
Yeah.
I think that's the hardest part about like learning physio per se, is like you get taught it for a reason. Like, I get why they teach it the way that they teach it, but you get it taught with like not including the human in the picture, and then you go out into practice and like it's all about the human in front of you, and there's so much uncertainty in humans in like their experiences and how they view things, and you know what they're dealing with in their own life and their beliefs, and there's just like so many things that go into that where it's like, oh man, it's very overwhelming.
And this causes a lot of people to feel imposters because they're like, well, I have all this stuff I don't know. How am I going to, help? And they seem to often think that, people who have been doing it for longer don't have any uncertainty, and that's how they deal with it, and that's why they don't have imposter syndrome.
Yeah, and you just start trying to like throw things at the situation. Like you're like, okay, you're falling back to like what you've learned. So you're like, okay, I'm gonna try this approach, and I'm gonna try this treatment technique, and I'm gonna apply that, and you just kind of try it all because that's really all you know how to do. And when those things don't work, because like sometimes things don't work regardless of what you're doing, whether it's exercise or some type of manual therapy, whatever, a lot of times you apply it and it doesn't improve the situation, and then you're kind of like, uh-oh, like what do I do now? Like you're digging in that toolbox that you have, looking around, and you've thrown everything at it, and you're like, well, shit, now what do I do? I guess I go take more courses, which then, we talk about this a lot, I think further drives the imposter syndrome, because now you're getting more information about different techniques that you don't really know how it even applies to the person in front of you, because like the challenge itself is the uncertainty of the human.
And, I think where we kind of start with this when people bring this up is, what do your clients want to know? Like, how do you want them to feel when they finish an initial assessment, for example, right? And you definitely don't want them to be leaving feeling super uncertain, right? And like worried about what's going to go on. You want them to have a sense of certainty, and what we're trying to help people with is how you can do that, even though there is a lot of inherent uncertainty within, working with people, especially when they have pain and injury.
Yeah, for sure. So like, what do you think are a couple ways that, you've done this, that we do this with people?
Yeah, so I think one way that I do this is I try to help them see what we do know about the situation. And I think when you start to actually think about it, you realize there are lots of things that you do know. To put out some examples, it's like, you do know it's likely not going to take a week. It's probably going to be in the timeline of months. That can really help somebody, because they're sitting there going, okay, I need to commit to a bigger timeline, right? Even if it's not exact. I don't think anyone really, like, that's unrealistic no matter what, right?
Yeah.
To give someone, your Kojiko person can barely even give you a window, to come and do their. So how nobody's going to expect you to be able to look into the future, know exactly.
Yeah.
But you typically know with like chronic tendinopathy, for example, it's like, this is going to be a bit of a road, most likely. Like, think about the timeline of months versus, weeks,
yeah.
Right? For the most part. So that's one way. You can tell someone, hey, this problem can improve. Right? That's a big thing. People want to know, can this get better? And the answer is usually yes.
Yeah.
Right? What things can I do to help calm it down, for example? Right? Hey, here's some movements you may want to avoid or modify. There's plenty of different examples that I'm sure most people, most students, most new grads know, that would be really good for someone to know and provide them a little bit of a sense of security.
Yeah, and a lot of times you can rule out any like things that are like sinister. You know, you can use your assessment skills to narrow down what tissue is involved. Like, you know, is this tendon related? Is this nerve related? Is this joint related? Is this a combination of, like, you can narrow that down a bit. You know, even in certain situations, you can be very confident that it's one thing versus the other, which then can lead to like communicating to them what is going on, how you manage it, what the timeline is like, and then how you would then proceed with some of those things like calming it down or starting to work towards a plan to getting them back.
Even stuff like, hey, you probably don't need surgery. You probably don't need imaging.
Yeah. And that's a powerful thing. Like I have like the other day I have an example of that where a client came in. She was a past client of mine, so we have a good relationship, but she was worried that she worried that she had a torn ACL because she played tennis a lot, but like she was not presenting with any ACL related symptoms. But she knows a lot of people who've torn their ACL playing tennis, and she had some like lateral knee discomfort from just like doing a lot more high intensity games. And like after we ruled out that it wasn't the ACL, and I gave her a couple things, the next time I saw her, she was like 100 times better. And it's like, well, why is she better? Like, was it these magical exercises that I gave her? Probably not. Was it the reassurance that there was no like, that she was going to be okay, that this wasn't something that like a lot of her peers experience? She felt more calm about the situation because she's like, oh, I don't need to like panic that I'm going to need to stop or that I have to do something more like surgery, and that all influenced the situation. So that is like something that's very powerful that you can do and communicate that effectively, you know?
Exactly. And those are a lot of ways where you can help with that. Even though in your mind you're like, well, I don't know exactly how long this is going to get better. You know, you never know how someone's going to respond. Are they going to go and do a bunch of tennis and flare it up even worse? Like,
yeah.
There's all these things you have no idea about, right? And if you let that drive you, then you're going to feel very uncertain. But when you realize how much you actually know about the situation, you can provide a lot of certainty for that person. In that case, it was kind of in the form of reassurance, right? Mm-hmm. Where you can be fairly certain it's not an ACL tear by what you're seeing, right? And that's not any like specialized skill. It's knowledge that most of us have from going through physio school, right?
Yeah, and even in that situation, because I think that's an easier one because it's very clear that it's not an ACL tear. But there are times where it's not as clear, and I'm not as sure as like what structure is causing it. But like going back to what you talk about is like it's less about the fact that we don't really know specifically, and it's more about what we do know and how we would approach something like that, which I think is the next thing. Is like, you know, you're talking about telling them, highlighting what they do know, which in a situation where the diagnosis is uncertain, it's like, okay, well, we do know you're experiencing this. We do know that it comes on when we do these activities and when, you know, you get done doing this. And we do know when you take some time off or you're relaxing, it feels better. And we do know that we can rule out for certain that it's not this, this, and this, but there might be a couple things that are going on here that we're not exactly sure how it's going to go. But if we take these steps and then laying out the next steps in the plan, we can then gather more information that will then lead us down a path that might tell us more specifically, you know, like what is going on here. And that's more like, I would imagine for the client, at least I'm hoping, like that's more comfortable for them, even though there's still an uncertainty around there. And then like I would dive way deeper in like what the plan would be to reassure that like, hey, we're gonna do something to move us forward. Then, you know, maybe not laying out a plan and not knowing where to go next because you're like, oh, I don't know.
You're providing certainty around what the process is going to look like.
Yeah.
And I think it's because what you want is for them to leave that session being like, well, I know I can get better. This is something I can do things about. It might take some time. There may be some ups and downs. There's some stuff we don't know. but I feel overall I'm doing the right things to take me
Yeah.
to the outcome that I want, right? That's the type of certainty that you want.
Yeah, and you can show someone that process without having a certainty in what is actually going on. Like, there's some unknowns, but like that's why we talk about the importance of having a 3-step process, like, or a process in general, because like we use calm it down, build it up, bridge the gap, and that is a framework that allows for us to communicate the steps in the plan that we're going to do, the process that we're going to do, amongst the uncertainty of like, maybe it's this, we're not exactly sure. But as long as people like can visually see like, okay, we're going to do these 3 movements to calm things down. We're going to modify these 2 things in your day-to-day life because it's driving a lot of, the pain that you're talking about. And then in the next phase, when that calms down, we're going to add in these 3 things that are going to build you up so that we can start seeing adaptation of, how you're tolerating things. And then when we get into the final phase, we're going to very much increase the things that we're doing, and they're going to look a lot more like your activity that you want to do, which may be running. So we're going to start to implement some running related stuff in this phase, all depending upon how you respond, right? And I think like if you show people that the uncertainty of like, is it this versus this, doesn't really end up mattering as much for the person.
Most people want to know, what can I do?
Yeah.
Is this something that can get better? How long should I be committing?
Yeah.
Those sort of things, right? And a lot of the stuff we actually do know, right?
Yeah, and I think if it is uncertain and you're just being truthful with that, I always try to be as honest with like what my process is in my head with the client. Like, hey, I'm thinking between this and this. This is why I'm in between these 2 things. Here's the path with this, and then leaving it open. And that's why I think showing the process is important, because like as long as they see the process, leaving it open to be like, hey, as more information comes in, we'll have more of an idea of like what might be driving this, and that can narrow down our certainty of like what's going on, which may pivot our plan a little bit, or it may not, and we may just be on the right course. But be open to the fact that like we're going to get more info that is going to move this process forward. And then I always take some time to explain with that, there might be some ups and downs with this process. Like there might be periods of time where it's a little bit more flared versus when it's not. And again, I think as long as you're communicating those things, it really helps reduce that anxiety for the client amongst the uncertainty of rehab, and it puts you in a better position to navigate the uncertain moments that will most likely come up.
100%.
Is there anything else on that?
No, I think pretty much covered it all.
Yeah. So like, I think like, the first thing you talked about was just like highlighting what you do know, and then highlighting the process, whatever the process is for you. If you haven't created your own process or your own 3-step plan, that's something to really think about. And then how do you try and lay that out to your client as openly and as honest as you can with the things that you're thinking about for them, and then always moving them towards what their goal is, which is another reason why it's important to get their why or their goal to drive them towards that. Sweet. We do have a free ebook on our website that talks about our 3-step process that you guys can download. I'll even throw it in the show notes of this episode for you to grab it. And, like we're not we didn't, invent this, but we've kind of built off of this framework over the years. And it's been something that we've had great success with ourselves, and then even with our team here. You can take that and use that process. You can manipulate it to be your own, but check that out. I think it could be helpful to a lot of the stuff that we talked about today. So you can find that at themovementmentorship.com or in the show notes. If you guys want to follow us on Instagram, you can follow us at PT Coffee Cast. If you want to see our beautiful faces, you can subscribe to the YouTube channel so you can see the video episodes. And yeah, I think that's it. As always, stay caffeinated. Peace.